For my course project, I have decided to do my research and everything on breast cancer. So, what exactly is breast cancer? Breast cancer often starts when cells in the breast begin to grow like crazy. They usually form a tumor that can be seen on an x ray or felt as a lump. The tumor is malignant if the cells grow into the surrounding tissues or spread to distant areas of the body. Breast cancer can start anywhere in the breast. However, most start in the ducts that carry milk to the nipple. Some can also start in the glands where the breast milk is made. There are some breast cancer that are less common than others. Just because it is common that a lot of women do find a lump in their breast does not mean that is the only way to find cancer. Some women go in for a mammogram screening, which can detect cancer at a very early stage before it can even be felt and before the symptoms start occurring. There is a difference when it comes to the lump that is found. For example, non-cancerous breast tumors are abnormal growths which do not spread outside of the breast, nor is it life-threatening. If the lump is malignant, that means it is cancer. However, some benign lumps can even increase your risk of breast cancer. So, here are some facts about breast cancer. The American Cancer Society's estimates for breast cancer in the United States for 2017 are about 252,710 new cases of invasive breast cancer that will be diagnosed in women. Also, about 63,410 new cases of carcinoma in situ will be diagnosed. And about 40,610 women will die from breast cancer. Breast cancer is the second leading cause of cancer death in women. And the chance that women will die from breast cancer is 1 in 37, which is about 2.7%. However, the good thing is that death rates from female breast cancer has dropped 39% from 1989 to 2015. But since 2017, breast cancer death rates have been steady in women younger than 50. Right now, there are more than 3.1 million breast cancer survivors in the United States, and this is with women who are currently being treated and who have already been treated. There are plenty of signs and symptoms when it comes to breast cancer. The earlier that you find breast cancer, it gives you a better chance of having a successful treatment. Usually, the most common way to find breast cancer is a hard lump or mass. And this mass could be on the breast or under the axillary. There could also be swelling of all or part of the breast. There could be skin irritation. There could be nipple retraction and redness, scaliness, or thickening of the breast skin or nipple. The mass could be painless that has irregular edges, which is most likely cancer. However, they can also be soft, tender, and rounded. Most mammograms do not find breast cancer, so it is important to know any changes in your breast and know all the signs and symptoms of breast cancer. There are several risk factors in everyday lifestyle that can put people at risk for getting breast cancer. Drinking alcohol being number one, this can be linked to getting breast cancer because women who consume one alcoholic drink a day have a very small chance. However, those who have two to three alcoholic drinks a day have a 20% higher risk compared to women who don't even drink at all. Also, being overweight or obese puts you at risk because before menopause, your ovaries make most of your estrogen, and fat tissue only makes a small amount. Having more fat tissue after menopause can raise your estrogen levels and increase your chance of getting breast cancer. Another risk factor that I myself never knew is taking birth control. They say that if you take the oral contraceptives of birth control, most studies have found it has a higher risk of breast cancer than women who have never used them. Some risk factors that you just can't change is being a woman in general. Women have a higher chance of breast cancer than men do. Also, just getting older and having a family history of breast cancer. Having a family history of breast cancer just puts you at risk for anyone who has had it in your family previously. So there are some conditions that women may have. However, it will have no risk of you getting breast cancer. The following include fibrosis and or simple cyst, mild hyperplasia, adenosis, phylloid tumor, a single papilloma, duct ectasia, and periductal fibrosis. These all, a lot of women or anyone in general could have these. However, like this, just because you have this, it won't put you at risk for getting breast cancer. Getting diagnosed with breast cancer ultimately means having to undergo therapy or treatment. This can include chemotherapy, radiation therapy, or surgery. Chemotherapy is usually given with an IV through a vein or as an infusion over a long period of time. Side effects for chemotherapy include hair loss, nail changes, mouth sores, loss of appetite, nausea or vomiting, and diarrhea. Most women with breast cancer will have some type of surgery to remove the tumor. And a lot of women usually get a breast reconstruction after having a mastectomy or a lumpectomy. And they do this to prevent the cancer from developing again in the future. A breast reconstruction can be done months or even years after the mastectomy. During the reconstruction, a plastic surgeon creates a breast shape using an artificial implant, a flap of tissue from another place of your body, or both. Some medical terms, just to so you guys know the difference, a breast surgeon or surgical oncologist is a doctor who uses surgery to treat the breast cancer, and then a radiation oncologist is a doctor who uses radiation to treat cancer. Lastly, there's a National Breast Cancer Foundation, and through this foundation, it is to help women by providing help and inspiring hope to those affected by breast cancer through early detection, education, and support services. With healthcare costs rapidly increasing, a lot of women just cannot absolutely afford the cost of a screening test. This is why National Breast Cancer Foundation provides pre mammograms to women across the United States through network of hospitals. Another great place to get involved and help out is a website called breastcancer.org. Since 2000, they have been a source of comfort, knowledge, and support for more than 72 million people affected by breast cancer all around the world. Every $1 they raise helps 3 women get the care that they need.